Hello everyone, this is Teach Me channel and I'm Sarah. In this video, we will talk about the physiology of blood pressure. Blood pressure is the driving force for blood flow needed for tissue perfusion. That is why it has to be tightly regulated. If there are changes in blood pressure, like increase or decrease, then we're getting two responses to regulate the blood pressure, an immediate or acute response and a long-term response that we will discuss in this video. But first, we need to understand the meaning of blood pressure regulation and how it is done. Your blood pressure is determined by the cardiac output and systemic vascular resistance. And remember that the systemic vascular resistance regulated at the level of arterioles, and your cardiac output equals heart rate times the stroke volume. Any changes in cardiac output or systemic vascular resistance will change your blood pressure. For example, your heart rate is controlled by the autonomic nervous system, and your stroke volume by the filling pressure under the influence of sodium. Your systemic vascular resistance is controlled by humoral, neuronal, and local factors. Humoral can be constrictor or dilators, constrictor like angiotensin II and catecholamine, dilators, for example, nitric oxide and prostaglandin. Neuronal factors is also divided into constrictors and dilators, constrictor like alpha adrenergic and dilators like beta adrenergic. Lastly, local factors like autoregulation, pH, and hypoxia. So, any changes like increase in your cardiac output or increase in the systemic vascular resistance will increase your blood pressure. Your central nervous system comes into action as an acute response when the blood pressure is not regulated, and it's sensed by the baroreceptor. Baro means pressure. Baroreceptors are found in two areas, carotid sinus and aortic body. So let's take the example of having high blood pressure. High blood pressure means we're going to send signals, we're firing. Carotid sinus signals will be carried through cranial nerve number 9 and aortic body through the cranial nerve number 10 to the medulla, solitary tract nucleus. The medulla will send parasympathetic signals, and parasympathetic will do its work by decreasing heart rate and contractility and causing vasodilation. And remember this time, kidney is not involved, all of which will give an end result of lowering your blood pressure. On the other hand, if you're having low blood pressure, only the carotid sinus will feel it. And we're going to have low or less firing through cranial nerve number 9 to the medulla, solitary tract nucleus. This time, medulla will send signals to the spinal cord, sympathetic chain, to release norepinephrine. And norepinephrine will do its work by increasing heart rate and contractility, vasoconstriction, and this time, renin release, all of which will cause rise in blood pressure. Renin-angiotensin-aldosterone system, or RAAS, is the long-term response by the kidney to regulate the blood pressure. The kidney feels low blood pressure or low perfusion to release renin. Keep in mind that renin is also secreted as a response to autonomic nervous system and low sodium chloride. So, if renin is in the blood, it will look for and convert angiotensinogen, formed by the liver, to angiotensin 1. Angiotensin 1 will be converted to angiotensin 2 in the presence of angiotensin-converting enzyme formed by the lungs. Angiotensin 2 does many things. First, it causes vasoconstriction, water sodium chloride retention from the proximal convoluted tubule, antidiuretic hormone or ADH release from the posterior pituitary gland, as well as aldosterone secretion. Aldosterone will cause water and sodium chloride retention from the distal convoluted tubule and potassium and hydrogen excretion. One last information. When bradykinin is in the blood vessel, it will cause vasodilation. However, angiotensin converting enzyme will inactivate bradykinins. And here's the summary from TeachMed for the physiology of blood pressure.